It's been another bleak day in Sydney's COVID outbreak with record infections, but Victoria and South Australia got some welcome news. From midnight, Victorians will gain more freedom, with lockdown conditions easing across the state. Hospitality will reopen with density limits, schools and gyms too, and travel bans beyond 5 kilometres will be scrapped. But no visitors will be allowed inside homes for the next 2 weeks.
We're able to make some significant announcements today. There is significant good news in here and significant freedom, but we also have to be cautious. This has not gone away.
For the third day in a row, all of Victoria's cases were in isolation. South Australia's 7-day lockdown will also end tonight, after the state recorded no new cases today. In Sydney, the news is less cheery. New South Wales recorded its highest ever number of daily cases, and the number of people infectious in the community still remains high, at least 79 today. More depressingly, the curve seems to be stubbornly heading in only one direction. Lockdown orders have been lifted in the central west of New South Wales, but the sheer volume of tests has reportedly resulted in New South Wales health authorities having to ship tests interstate to keep up. The comparisons and political tensions over the management of the outbreaks in Victoria and New South Wales are barely concealed now at the daily press conferences, and Victoria and other states are increasingly imposing the ring of steel around the Premier state that Dan Andrews says the New South Wales Premier should herself be imposing.
There's a refusal to lock people in Sydney into Sydney, so therefore I have no choice but to make these changes.
We have our own course here in New South Wales. We have a mission to keep our community safe, but also to make sure that we can look forward to living life more freely. And clearly, we're not at that stage yet, and the New South Wales Government continues to take the best health advice on the way forward. But it's also clear for us that we need to intensify our strategy to ensure that the population comes forward to get vaccinated. We know that the next few weeks are going to be extremely difficult for New South Wales.
Contact tracing in New South Wales has been held up as the gold standard for the nation, and lockdowns are meant to give contact tracers the chance to get on top of an outbreak. But with thousands of close contacts to run down in the Sydney outbreak, there are fears the system could be overwhelmed. Hagar Cohen reports.
The fact that we've kept the numbers at bay to this extent is something I want to thank the contact tracers and everybody in health.
Don't go out, don't do anything you shouldn't be doing, and don't go and visit other households.
In a city under lockdown, a visit to the local supermarket is one of the few reasons people can leave their homes.
Our Woolies is a community hub. It's a lovely little shopping centre with sort of everything that you really need to get there.
Kathy Pribanow was one of many customers from Sydney's northern suburbs who visited the supermarket on July the 16th. At the time, no one knew that one of the workers there had become infected, but within 5 days, 4 of them had become infectious. Days later, when the spread was detected, an estimated 5,000 shoppers instantly became close contacts.
Anyone who has been to Woolworths there was a 5-day, Friday, Saturday, Sunday, Monday, Tuesday and Wednesday, have all received close contact texts. Honestly, I really only know of 3 people in my area that are not in full isolation.
It's just one example of the mammoth task confronting contact tracers in Sydney. On the 17th of June, there were just 2 active locally acquired cases reported in Sydney. By July the 8th, this has grown to 376 active cases, with around 7,000 close contacts in isolation that day. 3 weeks later, New South Wales Health says this has doubled to 14,000 close contacts as of yesterday at 1 p.m.
Within 14,000 people, you'd have to say there's a lot of room for error.
It's not only close contacts that are under the spotlight. A According to data journalist Juliette O'Brien, another key indicator of the speed of the Delta transmission is the number of cases still under investigation, which means they don't know the source of those positive cases or where they got infected.
The real-world consequences of these numbers is that if we open up with evidently multiple undetected chains of transmission, how are they going to keep control of it without these restrictions?
Sydney's Delta outbreak started with one case under investigation on the 17th of June and was up to 21 cases by the 17th of July. Just 2 weeks later, it's grown to more than 60 cases. While the figures are revised down as links are made, it shows that numbers are growing rapidly. In Belrose, Kathy heard the local supermarket had been named as an exposure site through the local grapevine.
I learnt from a friend of mine whose child works at Woolworths that there had been a positive case. As yet, I hadn't been contacted by New South Wales Health, but she knew that I go to Woolies to get my food.
Kathy received the first notification from the contact tracers 5 days after her visit to the shops. By that time, she'd already gone to get her vaccine.
I went into the city on a bus to get my first vaccine. That was a bit worrying in the hindsight of finding out that I could have been exposed, because there's so many people that I could have, had I been positive, that I could have infected.
In a statement, New South Wales Health said exposure sites can only be identified several days after the infected person was there, which can then seem like a delay in notifying the public. Kathy's neighbour Jo Culler also shopped at the supermarket with her granddaughter during an exposure period, but when she didn't get a text from New South Wales Health, she called them.
I found out that even though I had used my New South Wales service QR and checked in, I wasn't on their contact list. They had no record of me being at Woolies on the Tuesday.
Jo says she was told that she'd be added to the list and instructed to isolate.
It appears that it was a glitch. She couldn't explain why I wasn't on the list. The glitch, it tells me that the system is overwhelmed.
There are now 5 Sydney local government areas under tighter restrictions than the rest of the city. One of them is Canterbury Bankstown, where the Campsie shopping centre is a popular destination.
On the 17th of July, my wife went to the Campsie Centre to just do a bit of regular shopping and to pick some things up.
2 days later, 2 Campsie Centre employees tested positive after working there throughout the weekend, including when Justin's wife went shopping. The contact tracers reached staff almost immediately, but other close contacts were left in the dark, including neighbouring shops at the centre. 730 understands that the centre's management became aware of the infection through one of the security guards. The management sent a letter to all of the other employees informing them about the 2 COVID cases. It said management had yet to hear from contact tracers and urged staff to get tested. The letter soon turned up on social media.
My wife received a document through a social media app, which was from the shopping centre operators, saying that some staff at a couple of the stores there had been diagnosed with COVID. So I went online immediately to New South Wales Health and tried to check to see if it had been listed on any of the websites, and it hadn't been notified at that time. So we were, we were effectively ignoring it until we heard something further.
Justin's wife received the close contact message 4 days after the first employee returned a positive test.
We found the time lag from when my wife had attended the supermarket to when we were being notified a bit concerning.
Since the first 2 cases at the centre were identified, 2 other shops have had employees that returned positive tests. Last night, an urgent alert was issued for shoppers at the entire Campsie complex for 11 full days. At today's press conference, the state's COVID Public Health Response Director, Dr. Jeremy McAnulty, was questioned about the centre.
It's a community where we had a lot of cases, and sometimes it's difficult to tease out, what the source of the infection was versus where people are just travelling when they're infectious.
Every hour you save is potentially an hour of exposure. Someone who's infectious out in the community is saved as well. And so you have to follow up as quickly as you can.
Professor Catherine Bennett says that time lags like in Campsie shouldn't be happening.
That is a concern. As I said, every day counts. And if you have a 4 to 5 day lag, then that entire time people could be infectious.
The Campsie experience has been replicated in other parts of Sydney.
These time lags does cause a significant concern in the community.
Councillor Kun Huang says a large percentage of his community don't speak English. Some of them who receive the close contact text don't know what to make of it.
They're asking the basic question, what is this? What is this? Like, can you translate it for me? What are they asking me to do? Is this text message even real? Is this a scam?
Councillor Huang already translated the government's text to 10 people in his local area.
The information that was sent to them are only in English. This creates a problem, especially for these people who don't speak English. This information could be the difference between a positive case in isolation and a positive case in community. To me, this is very concerning.
In a statement, New South Wales Health said that about 30,000 people have been contacted in relation to the Belrose and Campsie exposure sites, and there are many factors which influence who gets contacted and when. But the question remains, can contact tracing turn Sydney's growing outbreak around?
We seem to be seeing more of these spreader events amongst cases, and that it continues to reseed the virus back into new homes. And even if you get right on top of that exposure and follow up all those cases using our rapid contact tracing, which we do in all states now, it's still not enough to get to the contacts before they're infectious.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.